Well, good afternoon, everyone, and welcome to the COVID-19 update for Friday, November the 6th. Today, I want to review contact tracing data. Across Illinois, our 97 local health departments, operated by counties and cities across the state, are each in charge of reaching out to people who have tested positive for COVID-19 locally and evaluating all of their contacts, determining from there who else in their communities may have been exposed. And IDPH distributed $237 million last summer to fund that effort, including hiring new staff and implementing new technology. This local approach ensures that healthcare staff are reaching out to members of their own communities, helping to build trust and better engagement with this program. Contact tracers at each local health department then submit all of the information they collect into one central system that feeds up to IDPH, resulting in the statewide data that you see here. But these percentages are an average across the state. Each local health department varies in its performance, with the majority of the health departments, 57 of the 97 as of late October, reaching out to at least 90% of individuals who test positive, and 86 of the 97 reaching out to at least 75% of positive cases. The remaining counties are still building out their programs. On dph.illinois.gov/COVID-19, you can survey the results in each of our 11 regions and by each of the local health departments within them. Among the 97 local health departments, Chicago and Cook County are still ramping up and working to bring on more people and get more of their information into our central state system. But among the remaining 95 public health departments statewide, we've been able to reach out to, on average, more than 90% of people who test positive. Throughout this process, IDPH has invested in new technology infrastructure, trained each local department through the centralized program, helped expand their workforces, and supported public awareness campaigns across the state and locally. We've also made it a priority to review our approach regularly and engage in a continuous improvement process. Here's one recent example. Earlier in the fall, we surveyed consumers about a variety of contact tracing messaging to measure both a person's willingness to even answer a phone call from the contact tracing team at their local health department, as well as willingness to then go ahead and share contacts with contact tracers. The survey showed a significantly higher tendency for people to answer when we changed the statewide caller ID to Illinois COVID Help. So in October, we made that change. This is where the public can really help us out. Just like wearing a mask, answering a contact tracer's call is a way to help keep your family safe and protect your community. And that's going to be even more important with community transmission as high as it is right now. No one will reveal your private information or the person who tested positive. But we want to be sure that you know you've been in contact with a positive case and what your options are to keep yourself and your family safe. One other important thing that we ask is that when you get a COVID test, please write your accurate phone number on the form. That's vitally important, your accurate phone number. We can't help you, frankly, if we can't reach you. Next, let's talk about outbreak and exposure data. These are two words that get thrown around incorrectly a lot, but they actually have very specific, distinct meanings in public health. To start, let's talk about an outbreak. The location of an outbreak is more difficult to identify than the location of an exposure. An outbreak is defined as 5 or more cases that are linked to a specific setting during a 14-day period. Linked cases must be from different households and not already connected from other sources. And while certain settings like a college campus, a factory, or a group home may make it easier to determine an outbreak, most establishments that are frequented by the public, like restaurants or grocery stores, are not easily determined as the setting of an outbreak based upon those rules. Add on to that this disease is a respiratory in nature, and a person might take some time before they start to show symptoms. And you can see why where outbreaks occur is important information, but far from the whole picture. Much more useful for identifying regular locations that amplify the spread of the virus is exposure data. Particularly useful for the average person who wants to design their day-to-day in a way that reduces the highest risks. Exposure data comes from contact tracers talking to confirmed positive COVID patients about the places that they went in the time before they were symptomatic or tested positive. For most people, especially those who don't have the ability to work from home, that's going to amount to multiple locations. The day before a person tested positive, for example, she might go to work and then stop at a grocery store and then stop and get drinks with friends at a bar. That's 3 exposure locations, and that's just one day. Why is this important? Because exposure data is going to give you a sense of where you're at the greatest risk for catching COVID-19. And particularly when we see community transmission as high as it is around the state, the risk is going to scale up across the board. Remember, masks are vitally important and the best tool for reducing risk, but even with a mask, you don't eliminate risk, especially when inside in proximity to other people. And when you're taking your mask off in public to eat or to drink or even to chat, you're upping your risk. So here's our exposure data to date in Illinois. As you would guess, workplaces and schools are going to be big because anyone reporting to their workplace every day or any student or teacher engaged in in-person learning who tests positive is probably going to list school or work as a place they were before they tested positive. But the single largest category of exposure location statewide is restaurants and bars. And we see similar trends on a region-by-region basis, which you can review on the IDPH website. This aligns with the CDC study that came out earlier this fall. The study shows that when a COVID-positive person could not identify a close contact that may have given them COVID, they were twice as likely to report dining in a restaurant in the 2 weeks prior to diagnosis. These are facts. And if the facts change, we can change our response. But all the data we have so far points to these locations where people remove their masks in close contact for an extended period of time as a major source of risk. And frankly, importantly, our mitigation plans reflect the fact that those are a major source of risk. Moving to school exposure data. I know the size of that school column on the exposure sites might alarm some parents, so I want to offer a couple of caveats on this data. First, this is exposure data, not necessarily the exact location where a student or teacher actually contracted COVID-19. Anyone who goes into a school building regularly would have likely reported school as a place they went before they became a confirmed positive. That doesn't at all mean that school is where they contracted the disease originally. And remember that masks are required in school and are not intended to be removed for extended periods of time. Second, while we have school-based data broken out by school on our website, this is exposure data that comes through contact tracing at local health departments. The best data for any one specific school will come from the area local public health department. Schools are required to let parents and local health officials know about any positive cases. In terms of school outbreaks, we have 10 schools that have currently reported confirmed COVID-19 outbreaks across the state. Again, local health departments will be the best source of information on any specific school. These outbreaks do not include secondary cases that may occur in a household, among a household member who's not been on the school grounds. But they do include those associated with before and after school programs like sports. In our statewide outbreak data, we see a pattern of formal group gatherings making up the majority of our confirmed outbreaks. Again, these are the settings where it's easiest to trace the origins of someone's illness and declare a situation a formal outbreak. I mentioned the reasons why outbreaks are difficult to pin down, and I'll add that with rates of spread the way they are right now, it's only going to get harder because this disease isn't concentrated right now. It's widespread. This data will be updated every Friday for you on a weekly basis, joining the rest of our publicly available COVID-19 metrics at dph.illinois.gov. And with that, I'd like to turn it over to Dr. Ngozi Ezike.
Good afternoon and happy Friday. In addition to the data that the governor just spoke about, I want to tell people that we are also adding, similar to the CDC, we will begin reporting confirmed and probable cases. I know that the various CDC terms may be new and or confusing, so I want to explain this update so you can best understand the numbers. I'm thrilled that so many people are following along on our website and following the information, so we want to make sure it's all clear. As information, science, treatment, and testing have evolved, so too has our response. In August, the national case definition was changed so that an antigen test alone would be considered a probable case. With the increased use of antigen tests, we will get more probable cases, and we want to make sure that we capture all of those cases that are diagnosed via antigen tests, similar to how the CDC does this and similar to how other states are calculating this as well, so that we can show our actual true burden of disease here in Illinois. The result of this is that the total number of cases since the beginning of the pandemic that we report today is going to look quite a bit higher because we have added all the probable cases since the beginning of the pandemic. Those were already reported each week on our website, but we're bringing that in. So there's approximately 7,600 additional cases that will be added to Illinois' total number of cases. To be clear, these are not being counted as new cases that occurred in the last 24 hours. These are previously reported probable cases that are now being included in our total grand case count instead of having them separated out. So today, for the new cases that were reported over the last 24 hours, that number is 10,376. And that creates total number of cases 465,540. That unfortunately, we reported 49 additional deaths for a total of 10,079 lives lost. In the hospital overnight with COVID-19 were 4,090 individuals, and of those 786 were in the ICU, and 339 were on ventilators. In the last 24 hours, we recorded an all-time high of 98,401 tests that were reported for our state running total of tests at 8.2 million. I'd like to remind everyone of the importance, again, of contact tracing, as the governor illustrated, and how answering a contact tracer's call and answering their questions can help slow the spread of the virus. If you test positive for COVID-19, a contact tracer will reach out to you to offer guidance and support about what you should do and answer any questions that you may have. The contact tracer will, again, to be able to provide that information that's listed, that was listed on the screen, will ask about the places that you've been and the people you were in close contact with during your infectious period. After that, the contact tracer will then reach out to your close contacts and let them know that they've been exposed to someone who has COVID-19 and let them know that they should be tested at the appropriate time and quarantined at home. The contact tracer will not tell any of your close contacts that you were the individual that was infected. They will simply indicate that you have been in close contact with someone who has tested positive, and they should quarantine so that they don't spread the virus on to others. But of course, I know most people, if they are identified as having COVID-19, I'm sure you will reach out and let your contacts know yourself, so that call should not be as much of a surprise. But just be clear that the contact tracers will not identify the person by name. So please, if you get that call from Illinois COVID Help, please answer the phone and answer the questions. And as the governor said, make sure you give the right number. Don't give the house phone that no one listens to. Please give the appropriate number so you can be contacted. Again, this isn't just about you, this is about all of us. The next several months are going to be very tough. They're going to be very hard. But how tough and how hard and how bad it is still depends on us. Let's please think beyond ourselves and do what we can to protect all of us. Again, that involves masking, maintaining your distance, washing your hands. And please get your flu shot.